It's a disease affecting our furry friends. However, it could be treated if you take action quickly. And here now in today's Forever Family is veterinarian Dr. Caitlin Ondeck. Dr. Ondeck, welcome. Thank you for being here. Okay, tell me a little bit about Shepherd. This was a case that you saw recently there at the U of I.
Yeah, Shepherd was a 10-month-old kitten who presented to the U of I for acute onset neurologic signs of being unable to walk. He was transferred to the neurology and neurosurgery department where I took over his case as the resident. And through our workup, we found out that he had a disease called feline infectious peritonitis, or FIP.
And is this something that's common among cats, or is this something fairly new that we haven't seen before?
This is actually quite a common disease in our kitty cats, especially our young cats. It comes from a virus that is ubiquitous among cats that undergoes a mutation for reasons we don't fully understand and becomes this actually quite fatal disease.
But luckily for our friend Shepherd, it's quite the opposite. He had a good outcome because of quick action by his owners. So what were some of the symptoms that he was experiencing that made him come to you for the visit?
So FIP can present in many different ways. Shepherd had a neurologic form of FIP where he started to have some trouble jumping. He became very uncoordinated and unable to walk. And by the time he got to me, he had quite impaired consciousness.
That doesn't sound good. And I'm sure that was very terrifying for the pet owner. But there is treatment, and it's something brand new that maybe people don't realize is an option. So how did you proceed?
Yes, so there is this compound called GS441524 that has been developed a few years ago, but was not legal in the US until just this past June. Prior to that, people were getting it from the black market.
Oh my, okay, that sounds risky.
Yes, there's been a lot of kind of concern about this and about people treating their pets without any kind of veterinary oversight.
Yeah.
However, just this past June, one of our major veterinary compounding pharmacies was able to compound a legal form of this GS441524 antiviral in order for us to actually start prescribing and treating our patients.
And so that's kind of the quick action that maybe saved Shepherd's life.
Yes, it's a very effective medication in about 80% of our patients. It's quite expensive, but it really is a game changer for this disease.
Yes, okay, so Shepherd looks like he's doing very well now. So what's his prognosis?
Shepherd's prognosis we would consider to be quite good at this point. There is always the risk of relapse and of continuing neurologic signs even in an otherwise healthy cat. But as of right now, he's gone back to being a pretty normal 10-month-old kitten.
Very good. Well, we love success stories, and we love the work that you all are doing there at the University of Illinois, the Vet Teaching Hospital. If people want to learn more, maybe they have some questions about FIP, go to your website. You've got lots of valuable information.
Yes.
Okay, and if you want to learn more about FIP and the services that they provide at the veterinary medicine at the U of I, we'll connect you over at our website, ciliving.tv, after today's show.